I'm Michael Moore. I'm the CEO of the Public Health Association of Australia, and I'd like to start by acknowledging the role that Indigenous peoples play internationally and their relationship with land. I'd like to pay my respects to their elders past and present, because it is Indigenous people that by and large suffer much more than other populations whose health is so much better. I'd like to talk a little bit about advocacy, implementing the Global Charter and how it works with the Sustainable Development Goals. So let's start with the background. The World Federation of Public Health Associations identified a need, working with the World Health Organization, Margaret Chan, identified a need to have a horizontal approach to the issue generally of health. And it followed really from 40 years ago, the Declaration of Alma Ata, more recently, 86, the Ottawa Charter, because these were what I call horizontal approaches. And then we had HIV. And what we did was we developed effectively vertical approaches, so HIV, diabetes, heart disease, and so on. And we lost our focus of broad health and conceptually dealing with health. And what our Global Charter does is it takes those really three important elements of protection, prevention, and health promotion and identifies how important they are in terms of understanding what public health is. So many times over the 30 or so years that I've been working in one way or another in public health, people say, well, what is public health? Is it about the hospitals? Is it about where the government puts its money? But when we talk about public health, we really are talking about these three elements: protection, prevention, and health promotion. That makes it easy for people to understand what we're on about. But they're not enough on their own, because if we're going to achieve what we need to do to improve health, then there are four important enablers: good governance, accurate information, advocacy, and capacity building. But today, I particularly want to focus on the issue of advocacy and how the Global Charter can be used to implement the Sustainable Development Goals. So let's have a look at the Sustainable Development Goals. Let's have a look parallel at a Global Charter for the public's health. How do we work? And I'm going to just give a couple of examples of how we work these together, because they ought to be read, and it's identified in the full document of the Global Charter that they need to be read in conjunction. So Margaret Chan worked with the World Federation of Public Health Associations and asked us to develop this, but she also said the challenges facing public health and the broader world context in which we struggle have become too numerous, too complex for a business as usual approach. It's an important lesson for us. And we need to keep in mind, therefore, that we have a big advantage in that 193 countries are committed to implement the Sustainable Development Goals. This is something that we can use as a tool. So let me use one specific example of climate action and how that might fit into an advocacy process using the World Federation's Global Charter for the public's health. So Global Charter talks about protection, and what we need to do in protection is protect people, communities, the world from climate risks, and promote health through a low carbon development. I think most of us would agree that it's a critical health issue in terms of protection. So when we look at the Global Charter, what is protection? And identifies really clearly that when we deal with protection, we look at international health regulation and coordination, we look at communicable disease control, we look at emergency preparedness. These are all fundamental issues around climate change. We look at planetary health, of course, which includes environmental health, climate change, sustainability. These are issues that are just simply fundamental to public health. Now let's have a look at how we might carry out a role using these in terms of being advocacy. And the fundamental element that I'd like to emphasise, that when we carry out our advocacy, what we need to be is a critical friend particularly of governments who we're trying to work with. And part of that is my own experience as a politician. We don't mind being criticised. Politicians are used to being criticised. That's what oppositions do. But what we need to do is make sure that they see that the criticism is not a put down. The criticism is about being a friend. So there are 10 steps that are largely sequential in carrying out advocacy as far as I'm concerned. The first one is to establish a sense of urgency. Well, climate change, that's what we're talking about. The urgency is really already established. We only have to look at what's been happening in the Pacific, what's been happening in terms of the Arctic and Antarctic. We need to have a look at issues around hurricanes, issues around movement of disease vectors that are all associated with climate change. We can also look at drought, floods. There's a range of issues where there's no longer any doubt of the importance of climate change and its impact on health. But you'd never do your advocacy work on your own. So the next step is about creating a guiding coalition. Who else is going to be able to work with you in order to influence others about implementing the Sustainable Development Goal around climate change? Well, the environmental groups are the obvious ones to start off with, but we could also look at political organisations, we can look at unions, we can look at people in universities who are working on this, we can look at other health organisations such as the International Union on Health Promotion. We can also talk to the International Heart Foundation, cancer councils. They understand the critical role of climate change in health, and together we can have, of course, much more influence. They're just a couple of examples. The third step is about developing and maintaining influential relationships. You know, when we influence people, when you get something in writing, when you get a letter, it has an impact to a certain extent. But when you know somebody, when you've already got a relationship, that's when you actually seriously can make a difference. And building those relationships doesn't happen by accident. It's an important part of what a good health advocate does. Step 4 is developing the change vision. Know what you're asking for. If you do not know what you're asking for in terms of climate change, then actually you'll paddle around and get basically nowhere. So we're talking about climate change and health. We're talking about a vision that has a very clear idea. And of course, the fundamental for us is to adhere to the Paris Accord. We already have something that we can work on. And you have to be able to communicate that vision for buy-in, understand it, put it into ordinary language, use graphics. These are things that will be helpful. And then actually not just the guiding coalition, but looking at others who might be interested as well. So when we look at the World Federation of Public Health Associations, in one way or another around 100 members worldwide, and when you look at the number of individuals within those associations, we're talking hundreds and hundreds of thousands of people. Empowering that broad-based action, getting them engaged is a key element. The 7th step is about opportunistic. And in some ways it seems a little bit harsh because sometimes our opportunities arise out of disasters. So when we do have a serious flood in the Philippines or another typhoon in the northern Pacific, a hurricane around the Pacific Islands, maybe it's time to say, actually, climate change is real, people are dying, and this is something that we need to build on. Remembering that we also need to be able to measure and check what's going on. So generating short-term wins is very important in the political sphere. It's not that politicians don't necessarily have a long-term vision. It is rare, but some do have long-term visions. But what they have to have is short-term wins. So when we're talking about politics, let's go, okay, an output that a government has taken a stance. They will move on supporting renewable energy and cutting fossil fuels or making a greater taxation on fossil fuels, for example. That is a short-term win. It is something we should identify as a next step. Persistence is an absolute key element. And my colleague, Rob Moody, gives a talk on advocacy, and he says there are 3 P's in advocacy. They're persistence, persistence, and persistence. And I think it's one that's worth remembering. Finally, we attempt to incorporate those changes into culture. So, if you like, we ratchet the changes that we want in terms of climate change, that it's very, very difficult to go backwards once people have started to move forward. For example, in supporting renewable energy, those are published, and there's a reference there. And these 10 steps for influence are useful either to plan or to evaluate. So I'd like to now quickly take us through some of the other elements of the Global Charter for the Public Health and Protection. Now let's have a look at what would happen in prevention. So let's have a look at primary prevention, which includes vaccination, secondary prevention, screening, and then evidence-based care, which is fundamental and builds into healthcare management and planning. And these are set out in the Global Charter. And here's just one example of how they might apply regarding the Sustainable Development Goals. We'll look at Sustainable Development Goal 12, which is promoting responsible consumption of medicines to combat antimicrobial resistance. And let's think about responsible consumption overall. So antibiotic resistance is absolutely critical, and interestingly enough, a paper that came out in Australia recently suggested that antibiotic resistant deaths will overtake cancer within the next 30 or so years. It is a critical warning for us. But responsible consumption and production goes much further. Look at tobacco. Philip Morris International are selling their selves as a tobacco-free world. All of a sudden, Philip Morris are keen on freeing us up on tobacco. Hasn't stopped them advertising and pursuing all the same goals that it's done in the developing world as it has done for many years. But in the developed world, they are trying to move people across to e-cigarettes. And just recently, a major paper illustrating that each of the e-cigarettes also carries connections where they can track and understand people's behaviour, where they're going. We look at junk food, we look at alcohol, we look at how to handle these and what is our advocacy around this. It's about ensuring good government stewardship. And you'll hear many people going, oh, well, that's just nanny state. Yes, there is an interference with personal freedom, but it is the responsibility of governments to have good stewardship. That's why it is in some countries we see smoking rates down around 12%, whereas here in Geneva, obviously the rates are just so much higher. I watched a street sweeper today sweeping up cigarette butts. I just haven't seen that in my own community now for 15 years. It's good government stewardship, and when you see that, you know it's not happening in this particular instance on that particular issue. I'm sure they have many other issues where there's big improvements. Then, of course, there's health promotion. So let's have a look at fundamental health promotion is inequity. We look at the social determinants of health, the cultural determinants of health. We look at resilience, behaviour, but particularly health literacy, and that balance between personal responsibility on the one hand and the good government stewardship on the other, because it takes a combination of those things to deliver the most effective and the healthiest opportunity. But remember, when we talk about healthy settings, we're talking about the healthy choice being the easy choice, and that's something that has been fundamental to our advocacy. But have a look at Sustainable Development Goals 1 and 10, no poverty, reduced inequity. These are really fundamental also to health and fit in to what we're doing in terms of health promotion. Good governance is fundamental to how we implement the Sustainable Development Goals. So look at, and we mentioned public health legislation. I know others talk about health in all. We need strategic planning, we need good organisation. Most important, I think we need transparency and accountability. Just remember, when our political systems are not accountable, what tends to happen is huge multinationals inject money and with it influence into politics. And when you have influence, for example, from tobacco companies, it's incredibly hard to get good government stewardship because politicians are dependent on those companies. If you have a look at the United States, the inability of any government to be able to put sensible gun laws into place is contained by the amount of donations made by the National Riflemen's Association and the arms industry. And each of our countries has similar situations. In my own country, big gambling puts huge amounts of money into political parties. The outcome is that even trying to put a sensible pre-commitment around poker machines, for example, is nigh on impossible. And yet that doesn't interfere with personal choice. It just makes people think about what they're going to do. So good health and well-being is the overall sustainable development goal that has impact on us in so many. And for us, it's a focus on health for all. And look at the challenges: maternal mortality, AIDS, road accidents, non-communicable diseases. These are fundamental challenges, all of which can be the subject of effective advocacy. So one of the challenges in doing the effective advocacy and taking those 10 steps is saying, well, what are we going to work on? Are we going to work on all of these things? Are we going to work on some of them? And one of the joys, I think, of working in public health and public health associations, where you have committed people who will take on each one of these issues and then just have the support from associations such as my own association, the Public Health Association of Australia, where we can keep a broad view but support the advocacy action of individual members right across these elements. You know, when we talk about accurate information, I think one of the key elements for the Public Health Association of Australia, the World Federation of Public Health Associations and public health associations around the world, has been to work with public health institutions, the universities who are teaching this stuff, to make sure they understand the Sustainable Development Goals, they understand the horizontal approach of the Global Charter for the public's health. So when we have that tool available for us, we can use it to support education. So what we need to do is make sure that our students at undergraduate level in public health, at master's level in PhD, understand exactly what the evidence is, understand health policy, and using the example of vaccination, having open public health debates, but remembering the evidence around vaccination is not 50-50. 2% of the evidence that questions vaccination, 98% supports vaccination. And I think sometimes it's really important for us to remember that in public health policy, we need to explain why it is that we operate in the way we do. And we also need to think about the economic costs of public health failures around the world. And of course, that requires monitoring and evaluation. And when we're talking about accurate information, we have a responsibility to make sure we work in the media, the conventional media, but more and more in the social media. It is interesting that at the World Congress on Public Health in Melbourne, we had such an enthusiastic response in terms of the Twitter sphere that we had over 1 million impressions coming out of that conference alone. And I think there's a really important element on how we've got that message out. It was accurate information and it was shared very, very widely internationally. And we have to continue with our capacity building. We need our public health, we need our health workforce, we need our wider workforce. And when we're doing our advocacy work, we need to remind governments of the importance of these and the importance of prevention, because these actually cost governments in the short term, but get a long-term outcome. So when we talk about public health, we talk to governments, we should talk about spending on health care and investing in public health. That's the difference. One's an investment, one's an expenditure, and with it goes all the workforce planning that's set out in part of the capacity building elements of the Global Charter for the public's health, and we bring that back into teaching and training as well. Fundamental in public health, of course, is clean water and sanitation. It's basic to public health. We know the story of cholera. We know the story of how John Snow and Reverend Henry Whitehead did the first really epidemiological study. And some of the teachers that taught me about snow and clean water and sanitation said, and that's why we have sanitation right throughout England. It wasn't the case. We have to remember that that work was done But in 1858, in London, the House of Westminster sat on the Thames. The smell was so bad they couldn't sit. So what they did was they used the work of John Snow as a catalyst for being able to handle a problem that was obvious to themselves. And in our advocacy work, we have to remember that we can either find that catalyst or use the catalyst if one's already around. Sometimes we create. But it does remind us that whenever we deal with public health, we are dealing with something that is political. And so just as a notion, it's worth remembering for those who are in developed countries that 3 in 10 people worldwide lack access to safe, readily available water. It is an embarrassment. And I think that the report by UNICEF on the Sustainable Development Goals here is an opportunity for motivation. So, effective advocacy. Well, it takes leadership and ethics. It takes social mobilisation. It takes solidarity. We need a people-centred approach, community sector engagement, communication, sustainable development. And let's have a look at how it's identified. It's the 17th of the Sustainable Development Goals. Mobilise partners to monitor and attain health-related SDGs. Isn't this how I started? Basically, when I'm talking about the second of the steps, and I said, what you need to do is have the guiding coalition, the group that you can't work together. So the World Federation of Public Health Associations has over 100 people. The Chinese Preventive Medicine Association alone has over 110,000 members. They look after the Western Regional Pacific office and have the advantage that the World Federation works in formal relationships with the WHO. All of these things haven't just happened. These are key parts and key elements of advocacy, but they're elements that we can use in terms of our advocacy. So in conclusion, the question becomes, when you're talking about advocacy, which of these Sustainable Development Goals is going to be your focus? Because it could be any one of these is the reality. But what you do know is that whether you're a student, whether you're a public health professional, whether you're a medical practitioner, that the world needs you and we need you to carry out our advocacy. We've got an opportunity with Sustainable Development Goals, and I think it's an opportunity that we really need to grasp. Thanks for the opportunity to share these thoughts.